Without further ado, I would like to introduce our first speaker this morning, Dr. James LaValle. Dr. LaValle received his BS in pharmacy at the University of Cincinnati College of Pharmacy. He's a certified clinical nutritionist. He's a clinical instructor in the Masters of Integrative Medicine program at George Washington University and is educational co-chair for A4M and MMI. He's internationally recognized clinical pharmacist, author, board certified clinical nutritionist, and expert and educator in integrative and precision health. He's a thought leader in drug nutrition depletion issues and has published 4 books and 3 databases in this area alone. As such, he has over 35 years of experience integrating natural and integrative therapies into various medical and business models. His latest research is in drug-induced microbiome disruption. He was also named one of the 50 most influential pharmacists by American Druggist magazine. His experience spans from the super athlete to individuals struggling with chronic health complaints, organizations, and athletes from the Chicago Blackhawks, New England Patriots, Houston Astros, and Orlando Magic, just to name a few. We are very glad that you could be here with us, Dr. LaValle. Go ahead and begin when you are ready.
Hey, it's great to be with everybody today. And today we're going to talk about, I think, an incredible novel test that recently came on the market. And in particular, I want to tell a personal story about it. So about a year ago, I did a new genetics test, was looking at my genetics, and I thought, man, I've got every card working against me. And literally, if you think of how many bad genes you could click either heterozygous or homozygous for, I'm kind of in that category. So, whether it's obesity or methylation or detox, you name it. And about that time, I guess about 6 or 8 months ago, I was approached by TruDiagnostic. They said, hey, why don't you take our test? And it was interesting because the outcome was I was aging basically at the 95th percentile up to the 98th percentile. And what that really hit home for me was the value of understanding health span and what we're doing is actually, when we're working with the patient, are we moving the needle on improving the way they are aging at a cellular level and regressing the inflammatory, oxidative, environmental stress burden that is affecting everyone. And so we're going to talk about TruDiagnostic today. I'm really excited to do this talk because I know for me, it gave me a lot of not just insight on where I could improve, but also it gave me a lot of insight that, hey, you know what? You get dealt a hand, but you can always end up, putting a few cards back in, throw a few cards in and end up with, a full house, right? You can end up in good shape. So let's see what we got. So why do we age? Obviously there's a lot of factors that are involved in aging. So, it's obviously time dependent and it declines at a cellular level. And there's a lot of hallmarks of aging. Many of us, study these and work with folks to try to improve this. But you think of genomic instability, telomere attrition, a lot of telomere testing. I'm going to touch on that a little bit. Epigenetic alteration, basically that when we start to get environmental burdens, stress, nutrient deficiencies, exercise or lack of, diet, all sorts of things that can start to push into those epigenetic alterations. We get the loss of proteostasis. And these first 4 areas are thought to be the primary hallmarks or causes of damage. And then, of course, deregulation of nutrient sensing. When you think of that, you can think of the value of time-restricted eating. Of course, a lot has been going on in the literature and out in our space related to fasting and how that has an impact on improving health span. And then, of course, mitochondrial dysfunction, which is a byproduct really of multiple things. But one of the biggest is metabolic inflammation, which of course causes mitochondrial dysfunction over time as we get more and more pressure on mitochondrial function. And then cellular senescence, stem cell exhaustion, and altered intracellular communication. So when you think of it, when we're trying to help people, we're trying to pull together as much of this and lead it back towards a process of health as we can, regardless of their age, right? Some people at age 30 have, accelerated aging because of the metabolic inflammation, oxidative damage, and issues that are at hand. So why is biological age testing important? Now, realize this, guys. This has really only been going on since 2013. And only over the last couple of years have we seen this emergence of biological age testing, and why it is so important. Because obviously aging is the loss of function over time. How fast do I lose that function, and how quickly do I lose it actually will, lead to an accelerated aging process. And of course, aging, it creates the progressive damage of biological structure. So, you get damage to the heart, damage to the kidneys. One of the big things I'm seeing now is, a lot of folks in trouble with their kidney function at earlier and earlier aging. So biological aging actually is a precise measurement. It has, I think, tremendous value. I know for myself over this last year, I see it playing a more and more important role in how I'm working with people, because it gives me a tether point to what I'm doing with them. And, aging is the number one risk factor for most chronic diseases, if you want to look at it that way. If I can limit cellular aging, I delay the onset of the disease and illness. And, it's interesting. So when you look at this, aging is the greatest risk factor for the majority of chronic diseases. 80% of adults over the age of 65 have at least one chronic disease. And then, of course, chronic conditions of hypertension, cholesterol, arthritis, coronary artery disease, and diabetes, all related to aging. What I find to be alarming is that we're seeing these numbers push downward, so that we get this effect of what I call accelerated aging. And, it's just important to see that it's progressive damage of your biological structures. So whether you're looking at heart disease, kidney disease, liver disease, autoimmunity, dementia, the aging process is triggering this progression of illnesses, and of course, including cancer. So why is it thought to be so important to look at biological age testing? Well, there's, I think quite a few reasons. Aging, if you look at the bottom of this slide, aging recently given an ICD-9 extension code by the World Health Organization. So it's getting close to being recognized as a preventable and delayable process. I think that's really important. I think that's what we all strive for, right? That's why we're at A4M, right? American Academy of Anti-Aging Medicine. We want to reduce that journey towards aging and suspend, so that we have this great health span that we should enjoy. So how do we measure it? So chronologic age is easy, but you can have a 50-year-old that has 60-year-old body function, or you maybe have a 60-year-old that has 50-year-old body functions, right? So chronologic age really, obviously you are the age you are. Biologic age becomes incredibly important when you begin to look at this. And as I said in my introduction, till 2013, so just not even 10 years ago, there was no marker or combination of markers that would predict the rate of aging, that would monitor basic processes that underlie the aging process. And it must be able to be tested repeatedly. So easy blood draw, for example, or imaging. And it should be something that works for humans and lab animals as well. And so it can be tested in lab animals before being validated in humans. Of course, there's the original tests, and there's several good companies here that we've all gotten to know, was telomere testing. And telomeres are important because obviously as telomere length shortens, that's a threshold for activating DNA damage. So short telomere threshold, though, it's never, it's not really known in terms of the clinical relevance as it relates to a disease. And, it obviously can, influence treatment decisions in clinical settings, that part hasn't been really determined either. But what we do know is that as telomere length shortens, we're increasing our rate of DNA damage. So, we have great, products out there that have, interesting research that supports telomere protection. So things like TA65, but I would also say that making sure diet and exercise, we're going to go through those things in a little bit, are incredibly important as well. So when we look at telomere length, the leukocyte telomere length, which I think is an evolving marker, seems to be more clinically relevant as it relates to disease state risk. So, this whole area is evolving, right? So as we look at from 2013 to now, I think we're going to continue to see an incredible explosion of information as we begin to gather information on a multi-omics platform that will continue to refine our process of determining biological age of an individual. So when you look at telomeres, so women have an average of longer telomeres than men to begin with. So, they have a lower biological age than men when judged by telomere length alone. And then telomere length and overall cancer risk showed, a null result. So telomeres play different roles for different cancers. So, relying just on telomeres is not going to get us where we need to go, even though, we realize their importance in terms of support for protection of DNA. So telomere length, it's validated. There's no doubt that it plays an important role, but doesn't have as much predictive power. So when we begin to look at what's going on now, this is what I think is incredibly important, is looking at this multi-omics data where we can start to look at genomics, epigenomics, transcriptomics, proteomics, metabolomics, and of course, phenomics, in order to look at aging. And this model is evolving. I think with AI and calculation power of today, we're going to see enormous changes over every year because of our ability to crunch the data and look at correlations of not only what's causing this aging process, but also what are our interventions at each of these levels that will help us to correct these issues. Now, remember, you still get dealt the hand you get with your genetics. So if you were dealt a bad hand, then you're just going to, most likely have to work that much harder in the process of creating that longevity and health span. So epigenetics, probably the most highly predictive, without a doubt, highly predictive value age test. If you look up here at the epigenetic clock, this is kind of where we're at today. When you look at studies here on large scale, telomere length has the most. The epigenetic clock is here. And then we've got composite biomarkers and metabolic age scoring way down here, where that's just at the beginning. Now, where are we moving? We're obviously moving towards these metabolic age scores. It's why I've been so passionate about talking about metaflammation for so long over the last few years, because I think it's last 20 years. So I think it's really important to understand that we have to capture that essence of whole body metabolism, and epigenetic testing, highly predictive for that. So where is the future of epigenetic testing? Well, first of all, we look at DNA methylation. And so, the epigenetic testing we're going to talk about today has a strong inference towards DNA methylation and what its impact is on this whole platform of different omics and how that expresses itself as an aging process. There's different types of DNA modification. So you look at DNA methylation. Obviously, there's tremendous amount of research that's been out on DNA methylation. Then there's, of course, histone modifications, so acetylation, methylation, and phosphorylation, and then chromatin remodeling as well. So, once again, just realize that different tissues have different rates of aging, and that's really due to epigenetic modifications. So what is DNA methylation? Well, it's the process where methyl groups are added to DNA, and methylation can change the activity of the DNA without changing the sequence. So basically you think of, when you see that CPG island, for example, that's an area where you're really regulating and normalizing or creating homeostasis in your DNA transcription. And so when you think of DNA in the gene promoter area, methylation is typically, acts to repress gene transcription. And so in the end, the methyl groups are there to help to regulate gene transcription and protect the integrity of your DNA, so you're making healthy offspring blueprints. So in mammals, about 75% of the cytosine and guanosine pairings are methylated. So this is different than other, things like plants or invertebrates or those types of things. So high CPG methylation, it has a cost. It increases the frequency of spontaneous mutations too. So spontaneous mutations can lead to illness and disease, and that's what we're going to talk about. So how does it happen? It happens through, DNMT enzyme process. So you get cytosine being methylated to 5-methylcytosine. So when you think of the epigenetic clock, this is, where machine learning and AI really has, let this catapult forward. So there's an aging process that looks at CPGs and DNA methylation. So there's specific algorithms that analyze the cytosine pairing with guanosine pairs, and then had an algorithm that incorporates DNA methylation into that pairing when it's measured in blood to age estimate. And the algorithms are complex. If you look at this, it's things like naive CD8 cells, it's leukocyte telomere length, it's granulocyte count. Are you a smoker? Is it BMI? So there's a tremendous amount of data that goes into epigenetic testing. If you look at the top, it says Horvath's clock, 353 CPGs and a multi-tissue DNA estimator. Then there's the Hannum clock, which is 71 CPGs, LaValle's clock that was 513 CPGs. So in the end, we're assessing a tremendous amount of data related to the methylation of CPGs, and then algorithms were constructed to create a aging basis. And this is, how the test is performed. You guys have these slides. You can look through this, but this is just showing you that it's a 4-day and night process in order to get the results. So it's a pretty, complex test to get the results to your aging test, your aging score. How's your biological age calculated? Well, it's looking at methylated versus non-methylated CPG. I don't think you're going to show this to your patient, to be honest with you. You look at this equation and they would just look at you and glaze over. So according to one of the developers, this is of course Dr. Horvath, the statistical significance provided by a recently developed the DNA GRIN age clock. It's more likely that planet Earth will be hit by an asteroid tomorrow than it is that this predictor doesn't work. So basically what it's saying is that this is an incredibly accurate way to estimate aging based on DNA methylation. And of course, as we get through that multi-omics platform, I think through the lens of DNA methylation, we're going to be able to look at toxic metal involvement, whether it's mycotoxin involvement or whatever the process may be. Diet, of course, is important. So, epigenetics versus telomere testing. I'm not saying you've got to do, if you're comfortable with telomere testing, you're getting great results, you're seeing, changes in individuals, certainly, but I do want you to think of epigenetic testing, because if you look at it, is it predictive of disease? It is predictive of many types of disease and health-related outcomes. That's been correlated and published. So epigenetic testing is correlated to Alzheimer's and diabetes and heart disease. Does it report telomere length? Of course, both do, but the epigenetic test also, shows the leukocyte telomere length, which is predictive of time to death, coronary artery disease, and time to congestive heart failure, and then reports other risks of disease, and of course, yes, on the epigenetic test, and then your pace of aging, as well as your immune cell subsets. We're going to get that immune cell subset in just a little bit. You want to use blood. If you think of, so there's different ways you can test epigenetic tests. There's saliva, there's urine, but actually when you look at what's been published in the literature and what has algorithms written against it that have been published in the literature, it's a blood test. And I thought it was pretty simple. It was basically, 4 mLs of blood. It was a very small aliquot of blood to send in. So easy enough to do. And, the algorithm you want to use is important too. So why use a published algorithm? Because they're linked to health outcomes. Why do you work with algorithms? It's because obviously algorithms will be refined as more and more machine learning occurs. But you want to be able to get the metrics and the outcomes that have been published so that you're able to really kind of have a standard of measure against the individual that's sitting in front of you, right? So we kind of went through, the introduction to, the amount of CPGs that are tested, the complexity of the algorithm, but you hear about intrinsic and extrinsic aging. So one of the most important aspects of this is how the immune system is aging. And so as we age, we have a change in leukocytes and CD4 cells and CD8 cells. And so that these, and you get thymic involution, so you get immature T killer cells, and all of this triggers inflammatory aging, and it alters our antioxidant defenses. So one of the big features of looking at true age and looking at epigenetic testing is this fact that as we age, our immune system is at the center of that process. So the intrinsic age is really more to do with the cards that you've been dealt. It's kind of out of your control. It's your underlying genetic predisposition. And so there is a component to that your genetics do shape you to a certain extent based on what aspects of your life begin to influence it. So once again, diet, stress, exercise patterns, environmental exposures, metals, persistent organic pollutants, biotoxins, what type of drug history do you have? A lot of people on medications could be influencing their genetic expression. And so there's a lot of things that go into, triggering this, but that is really more about extrinsic epigenetic age. So it is really age acceleration that's dependent on, the cellular composition of your blood. I'm sorry, that is intrinsic, but then the extrinsic is more related to the age-related decline in your immune system. So when you look to the left here, it tracks age-related decline of the immune system as well as associated lifestyle and environmental factors. So this measurement really starts to become dependent on the work that we do, right? We're measuring, looking at metals, we're looking at biotoxins, we're looking at nutrient deficiencies. What type of diet does a person have? Are they overtraining? Do they not exercise enough, right? All of these factors, what type of medications are on, what their history is. Do they have any trauma? all of these things kind of add up and affect extrinsic aging. So, why separate them? So the risks of intrinsic age are, a little different, right? But they're associated with the aging. But with extrinsic aging, it in particular is more correlated with death from cancer or premature death. So you want to be able to reduce aging in both ways in order to really get to that health span that you're looking for. Here's obviously Dr. Liu and Dr. Horvath, Department of Human Genetics at UCLA. And if you read this, the Grimm age is 18% more accurate than calendar age, 14% better than previously described epigenetic biomarkers, and it is 61% more accurate than chronologic age and 46% better than previously reported epigenetic biomarkers. In spite of this, there's still noted that neither age nor the DNA Grimm age test is good at predicting time to heart disease. So if you look here, incorporating information on blood cell composition into the DNA, age test estimates further improvement in predictive power. So really adding these blood markers and looking at the various biomarkers that are within it created a tremendous amount of more accuracy and computing power. So what are the things that will help? I mean, this is obvious, guys, but we still got to talk about it. When you look at extrinsic epigenetic age, you think of eating more fish, fruits and vegetables. I always say 3 vegetables every fruit. Moderate alcohol intake. It's interesting that education and income play a role, and exercise plays a role, and moderate exercise to that. And then, of course, what's negatively creating this is insulin and glucose regulation. C-reactive protein, what your BMI is. Where are your triglycerides? What about blood pressure? And if you have adequate HDL cholesterol, that's a positive, right? And so it's important to understand that you're one of the hardest things I have with patients, for me anyway, is getting them to understand that they're, when you're creating programs for them, one, it has to be doable. So you do have to create a program that they're able to move to. Some people are able to go more quickly to a more rigid program than others. That depends on how sick they are, or how motivated they are. But in the end, changing their lifestyle, they're not being just put on a diet. They're not being told to exercise. You're creating a lifestyle that will be proven through testing epigenetic markers that it's affecting their health span. So the type of life they live, the type of choices they make can truly make that clock tick a lot slower in our age. So how well is your immune system aging? So when you look at the CD4 to CD8 cells, what's it tell us clinically? First of all, I think it's interesting that we see that COVID long haulers get a real disruption in their CD4 to CD8 ratio and a lot of thymic involution, right? So that triggering from that virus really does accelerate the aging of the immune system. That's some literature that's recently been published. So when you look at this, we have these immune cell subsets, and when you're looking at these immune cell subsets, it's as we age, we lose our ability to regulate immunity as well as to be able to defend ourselves. So that's the key with epigenetic testing and looking at the immune cell subset. And so when you look at this, the CD4 and CD8 cells are the key ones that are measured. And so when you have normal ratios, that's healthy. That means that you have a normal ratio of CD4 to CD8 cells. That's great. But when you get an inverted or a low ratio, that means the immune system is altered and you can induce immune senescence and get chronic inflammation. So, we have a lot of folks, whether it's in autoimmunity. I think, if you listen to Dr. Heyman's talks as it relates to biotoxins, mold toxicity, but biotoxins and what happens with SIRS, I think that's an incredible model. When you layer that on top of epigenetic testing, clearly, if we don't intervene in our SIRS cases, you're going to see accelerated aging from them because of the damage to their immune system. And this is kind of the predictions on the CD4 to CD8 ratio. So if you look in ischemic heart disease and stroke and stage kidney disease, non-age related death, in most cases, we see that as low CD4 to CD8 ratios occur, for example, in women with premature ovarian failure that occurs, that lower ratio is indicated for accelerated aging. So I don't want to go on too much more about this. I think it's pretty clear, but basically what we find clinically is that, as people, in the CMV model, as you can see here, the clinical laboratory and imaging findings suggest CMV infections, you get a lot of accelerated aging processes that occur. And basically, this is that process of, with many viruses, we get an alteration in CD4 to CD8 ratios. Same thing when you have a SIRS, event as well. So when you look at the CD4 to CD8 ratio in disease, this was the COVID-19. I mentioned this. If you look here, it says COVID-19 patients investigated across 20 peer-reviewed studies, 20 peer-reviewed studies. And basically what it showed was that CD4 T cells, CD8 T cells, B cells, NK cells, and total lymphocyte count showed statistically significant reduction in patients with severe and critical COVID-19s compared to mild to moderate disease. So in these individuals, so think of it this way, when you think of people that are diabetic, hypertensive, have autoimmunity, chronic obstructive pulmonary disease, people that have chronic metabolic inflammation, they're already in this kind of immune shift towards reduced vigilance in their immune system, and then they get COVID. And so the more compromised the immune system to begin with, the more intrinsically that we see the damage that occurs with COVID-19 cases. And I've already kind of went through this. So where's the clinical application? This is important, this rate of aging. This is from Duke and Columbia. And they created an algorithm where they could use blood samples to measure the pace of aging. It was called the Duned N POAM, and it's, which I think is interesting, pretty hard to say. Have your patients say that. And it predicts when people are at risk of poor health, chronic disease, or more immediate death. And this is a DNA methylation algorithm, once again, and based on blood. And I don't want to take too much time on this because I want to get into interventions, but basically, this was created in order to look at developing the algorithm. So if you look at one, they collected blood on 18, organ system function biomarkers, and they looked at their ages at 26, 32, and 38. They calculated the rate of change in each biomarker, and each individual's rate of change differed from the cohort norm. All right. Then step 2 was the pace of aging. So it's validated pace of aging from the criteria. And then once again, they were rated and as looking older based on their photographs, and they were reported themselves to be in worse health or not. So they created a pace of aging. And then they created this elastic net regression where they defined the pace of aging as a measurement that was obtained from a single blood sample. So once again, blood samples are the ones that have been validated and have been published on. And then, of course, there's validation of the algorithm. So they, that was the 4-step process on this. But I want to get past here because we only have so much time, and I put a lot of slides in here for you. So specific reports on aging, once again, so where does this apply? DNA methylation loci within the ABCG1 and the phospho1 and blood DNA associated with future diabetes risk. So there is a association on epigenetic testing with future diabetes risk. So looking at DNA methylation, which can be influenced obviously by environmental, diet, all the other issues, it has a big impact, and research is coming out now on diabetes predisposition. And these are the genes, of course, that regulate glucose and lipids as it relates to blood sugar. And if we look here, environment, genetics, alter DNA methylation, then we alter these specific gene sites and we get dysregulated gene expression and then the development of type 2 diabetes. So this is incredibly interesting, right? Because as we begin to think of DNA methylation, it kind of carries itself through all the different processes that relate to aging. Now, obesity predisposition, DNA methylation of circulating leukocytes here mirrors adipose tissue methylation patterns. So once again, can we see obesity predisposition with epigenetic testing? And the answer is yes. And I want to keep moving because this basically is just telling you that smoking has a tremendous predisposition. So hypomethylation marks on smoking behavior, morbidity, and mortality. So obviously, smoking accelerates the aging process. I think we all knew that. So the summary here, the hypomethylation is an epigenetic marker on smoking history, predicts risk of myocardial infarction, particularly in former smokers. So once again, epigenetic testing looking at now at excessive alcohol intake, another adverse event. And I just want to kind of move beyond that. Now, looking at clinical correlation, we already talked about this, and I think that, I want to get past leukocyte telomere length because I think it's the new method for testing for telomeres. It's very exciting and being published on and showing it's more predictive. So if you look here, it's a more accurate predictor on health outcomes. So if you look at leukocyte telomere length testing, time to death, coronary artery disease, a little more accurate, congestive heart failure, and associated smoking history. So it's a marker not just for epigenetics in terms of the cell, but it could be related to pathologies. And this is more in the study. Let's get into treatment. So when we begin to look at this, diet is so important. So what they're really figuring out, and we keep talking about the Mediterranean diet. The only thing I would say as it relates to that is we do have to watch people that are insulin resistant, and they do have to watch how many cereals and legumes they're eating, and are they allergic to foods? Turns out that, food allergies, especially ones that, activate the innate immune system. So the C3 or C3BD or the IgG4 subtypes, they end up triggering a lot of inflammatory chemistry, and that inflammatory chemistry induces interleukin 6 and TNF alpha. And when TNF alpha gets upregulated, that influences cell renewal. And when IL-6 is upregulated, it affects methylation of your DNA. So you don't methylate your cytosine as easily when you have IL-6 upregulated. So when you think of it, this may be, and I think Dr. Fitzgerald had a great study on nutrition and its effect on methylation. Diet's incredibly important, is one of the things that's going to regulate this. And so, as I said, when we go back here, fish, fruits, vegetables, moderate alcohol intake, legumes, nuts, seeds, clean protein intake, all of those things have a positive influence. And we eat more refined carbs, more refined sugars, drink excess alcohol, gain weight, eating foods that we're allergic to or sensitive to. All of those things are going to have a negative impact on diet. So if you look here, there's correlation underlying DNA SNP variants, which means that while positive, more research needs to be done on specific dietary interventions. You know what that means for me? When I'm doing a diet with individuals, I'm trying to figure out where their glucose is at, where their insulin's at, where their oxidized LDL is at, where their TMAO is at. And then, of course, you can look at lab markers like red cell width, and I already mentioned oxidized LDL, metalloproteinases, IL-1 beta, I'm trying to refine a diet for an individual that shows that they're reducing their markers of inflammation. They're they're getting to their ideal weight. And this is a 1-year Mediterranean diet study here that promoted epigenetic rejuvenation. And so once again, pilot study, but we see that there was a significant impact on the decline on aging at all. And then of course, results suggest that a Mediterranean-like diet has a pure rejuvenating impact on the biological clock. And so look, in the end, guys, whether you're eating a 30% carb diet with lots of vegetables so that your calories may not be quite as much on carb, but you're getting lots of vegetables. People have a variation in how much carb they can take in. That's been shown to be a genetic variable as well. The rules stay the same. Plant-forward diet, legumes, nuts, seeds, grains to tolerance, reducing the amount of refined flours, moderate fish intake. If you can tolerate dairy or the type of dairy, once again, at the top of that pyramid, and then, looking at, really minimizing sweets and watching for excessive red meat consumption, especially as it relates to TMAO production. And this is kind of, I've already went through this. So I want to get to this next. Now, B12 and folate. Now, I am not giving you these slides to scare you, but the reality is that I think we need to be a little less cavalier about giving lots of B12 and folate, meaning that just because someone has an MTHFR gene SNP, if their homocysteine is good and their mood is good and they don't show any aberrant detoxification issues, then maybe it's not necessary. And that there have been some studies that show that supraphysiologic dosing of folate and B12 could be detrimental in some cases. However, getting your B12 and folate from foods like green teas, all the different foods I just mentioned, like nuts and seeds, can end up improving the methylation of your base pairs for DNA. So when they looked at this, the study revealed that DNA among men with MTHFR genotype in comparison with other genotypes that respectively had dietary intervention was. And so what happens with this is that with women with the MTHFR 677 genotype, supplementing folate, especially methylfolate and B12 may be beneficial, but other than that, really hasn't been shown as much. And so this was the study that was done by Dr. Fitzgerald. And basically, here are the things that they tried to regulate. Sleep 7 hours a night, exercise 30 minutes, 5 days a week, manage your stress with twice daily breathing exercises. I teach that to everybody. 3 minutes twice a day, get your breathing exercise in to unload your sympathetic nervous system. And then supplemental adaptogens. So this is, looking at vegetables, prebiotics, probiotics, and remember, probiotics really are, have a dramatic impact, the microbiome dramatic impact on methylation. So in this case, the conclusion of her study was that supraphysiologic dosing may have unknown or undesirable side effects. I think you just have to watch it. You just have to watch for it. But I want to go back to what we know about using TruAge and the epigenetic testing for the biologic clock. Is it A, that it's very accurate? B, it'll give you guidance on whether what you're doing is effective. But more importantly, you still have to track these important markers like red cell width and oxidized LDL and insulin and neutrophils. And metalloproteinases, because you can really begin to understand whether you're moving that needle on getting a person well. Where is their metabolic or metaflammation index actually at? So this just talks about adaptogens helping with methylation. So when you think of green tea, curcumin, flavonoids, all of them can be beneficial at supporting methylation. And if you look at this study, it was interesting because what they basically showed that when people followed the plan, they ended up about 2.3 years younger versus people testing older than their age post-test. So if we look at this, immune augmentation, vitamin D, super important for a correlation to a better immune subset. Zinc, although thymosin alpha-1, obviously as a peptide, really important as well. That recently, less available. And then also growth hormone helped to regenerating the thymus tissue. I've already kind of went through this, so we're not going to keep going there. And then what else can happen? So thymic regeneration, when they looked at the TRIM trial, this was interesting, where they looked at recombinant growth hormone. Now, it did show that it helped to regulate the thymus, but it also showed that it increases the potential risk for diabetes or insulin resistance. So in the study where they gave metformin and DHEA, it tended to restrict that because metformin, of course, works on AMPK. However, I would also warn you that we shouldn't think of metformin as something that needs to be in the water, because metformin does deplete B12 and does deplete CoQ10, and which can also have its adverse effects on methylation. So just realizing that when we're using powerful drugs to try and mitigate this aging process, that we have to just watch for whether or not an individual is going to tolerate it or not. This was the work by Greg Fahey. And some of the things that they looked at were glomerular filtration rate, thymic density, and then they looked at specific reversible thymic function. And then obviously they were able to show that monocyte levels went down, they had a decline in CRP, and an improvement in NAD levels. NAD, really important in terms of epigenetics because it keeps the energy production in the cell normalized. So whether you choose to do, a lot of people are using NAD IV or doing NAD sub-Q, you can also think of using nicotinamide riboside, which is a precursor and goes through the salvage pathway. And that can be done orally, and that's been shown to increase NAD in the blood in studies. So nicotinamide riboside orally does work. I kind of talked about vitamin D, so incredibly important. And then once again, are you a candidate for metformin? Epigenetic markers associated with metformin. So there are some people that may be intolerant to metformin. That's why I said that getting individuals to universally use certain drug therapies, I think, can lead us down a slippery slope. So this is a 2020 study. This was the American Association for the Advancement of Sciences. And so this is actually where this talks about blood-based epigenetic markers could discriminate metformin response to tolerate or analyze genome-wide DNA methylation. So in some cases, metformin could be incredible, and in some cases, a patient may not be able to tolerate it and be more prone towards the side effects of it. So patients with higher degrees of methylation at the sites that were described, 2.5 times more likely not to respond, and up to 3 times more likely to not tolerate metformin because of severe side effects. So once again, understanding this kind of impact, we're in this new undiscovered country, and there could be some beautiful things that happen with metformin. I'm a big fan of the drug. I think it's fantastic, and at the same time, we realize some people don't do well on it. And environmental exposures accelerate, damage to DNA and alter DNA methylation. So it's been shown with aflatoxin and air and lead and air pollution, lead, mercury, persistent organic pollutants. So toxin exposure accelerates aging by altering DNA methylation. And then where's the future of testing? Obviously, we look at things like senescence. Obviously, with cell senescence, we see all these different dysfunctions. You get chronic inflammation and stem cell exhaustion. But we need to start somewhere. That's why I think epigenetic testing is so important, because it's giving us that really the first big building block in understanding our biological clock. So there's a couple different studies being shown to look at epigenetic changes in blood. Obviously, they're looking for changes in saliva as well in terms of regulating senescence and utilizing senolytics. And then, of course, if you see Dr. David Hosse's work on plasmapheresis, this is pretty amazing that when you look at it with plasmapheresis, that it's fascinating that it really turns back the aging clock double digits. So I think this is an emerging area, and I would really, encourage you to talk to Dr. Hosse because the study demonstrated that plasma-derived treatment markedly reversed the aging process according to epigenetic clocks and benchmark biomarkers for aging, meaning that plasmapheresis, if I'm not mistaken, it was quoted in here to reverse the clock 14 to 16 years. Hyperbaric oxygen also helps with immunosenescence. So it decreases immunosenescence, helps to revitalize tissues. And so we see, and there's some interesting things going on with oxygen that you may be able to drink and be able to get oxygenated blood. That's certainly a really interesting new area where it's kind of, getting hyperbaric oxygen by drinking oxygen. We talked about NAD already. I know I'm getting close to my time, but we talked about NAD already. I just want to make sure you realize that improving your NAD to NADH ratio helps with preserving DNA and DNA methylation. So there's, as I said, different ways to get it. You can use precursors like nicotinamide riboside. A lot of people talk about using NMN now. Just remember, NMN, nicotinamide mononucleotide, needs to be converted to nicotinamide riboside in order to, within the cell, in order to be utilized. So I'm much more of a fan of just nicotinamide riboside because it drops directly through the salvage pathway and affects, cellular energy production. Stem cells, obviously, this is a study from Germany here that showed a decrease in DNA damage, or basically had a rejuvenative effect within the first 6 months of stem cells. And so that was pretty incredible. I know a lot of us are doing research in all sorts of stem cells now. And that's basically it. I really want to emphasize again that if you look at epigenetic testing, and I would encourage you to go to info@TruDiagnostics.com. Here's the key. We give people a lot of therapies. I think that by utilizing epigenetic testing, we can start to show people how we're reversing the clock. I know for me, when I did my test, it made me, I guess, have a lot of, it created assurance that, hey, the things that I'm doing in order to maintain my health and try to get the most out of my health span, were working. And I think when you do that test and you do true age and you look at that result and you don't get a favorable outcome, it should be a measure of thinking about, well, what could I do differently? Because in the end, what we're wanting to do is expend our health span. And I think looking at aging as a chronic disease is actually quite accurate. So let me take a look here and see what we have here. Other products recommended other than TA for lengthening telomeres. Well, I think I just told you a lot. So, you look at curcuminoids, you look at flavones, you look at epidellocatechin gallate, you can look at something like alpha-lipoic acid. All of those are having effects at the metabolic inflammatory level that'll be protective of your telomeres. And so I think you can look at that. I think TA65 is a great product though. But once again, I would not just say, take TA65, don't worry about your diet, don't worry about exercise, don't worry about lifestyle. How are seeing COVID vaccines versus virus? Do you predict vaccine life extension from the vaccine? I have no way of knowing that. Great question, but I have no clue. Do life insurance companies do epigenetic testing? I don't believe so, not yet. How do we improve CD4 to CD8 ratios? Any supplements? The mushrooms are great. Reishi, shiitake mushroom, really solid for that. AHCC So the arabinoxylane, very powerful in increasing T killer cells, natural killer cells. Thymus extracts, even the traditional thymus extracts have been used for 50 years to reduce thymic involution. Do you recommend CoQ10 for everyone over 50? Well, sure, I think CoQ10 is important. It's incredibly important, especially because many people are on drugs that deplete CoQ10. And because CoQ10 is so important in the electron transport chain. And if you're deficient in nicotinamide riboside, you're also going to have issues in that electron transport chain. So yeah, CoQ10, nicotinamide riboside, I think as you're aging, they're two biggies. I'm going to hold on NAD dosing because it's all over the place. Interesting about metformin, does it apply to bergamot and berberine? No, not really. Not as potent, although berberine and bergamot are actually have been shown to have a lot of positive effects on inflammatory signaling. So it's a little bit different than metformin. I like metformin. Don't get me wrong. Please don't think that I'm saying metformin's bad, because I think it's an amazing drug, actually. Some of my patients didn't tolerate vitamin D capsules and drops. Not sure why. I guess I need to understand what the tolerance was. Is hyperbaric oxygen similar to getting ozone therapy? No, I think it's different. You're saturating with oxygen. Ozone therapy is a little bit more oxidative. Ozone therapy will kill viruses and bugs, in a little bit more, I'd say, acute way. I missed the beginning. Can you send a link to watch this again? I'm sure they can. Would plasmapheresis on long hauler COVID patients be a benefit? I would only theorize and think that it would. You may have answered this. I apologize if you did. I stepped away for a minute. Can we order this test? Yes, go to TruDiagnostic. Guys, I did this test. I'm telling you, it gave me so much, an incredible amount of calm to my regiments of what I did. Go to TruAge. You can do this test, and it's reasonable, guys. It's $300. I think that's what the cost of it is. I got that. PO versus IV NAD therapy compare. Well, I think IV NAD therapy is going to be more significant, say, in addictions or mood disorders. But I think if you look at Gnosis NAD, which is an NAD that does survive the gastrointestinal tract, you can get NAD levels that I think will help you to help you to replete. But I don't think it's going to be as potent as NAD IV. Can you use mushrooms still with long hauler COVIDs that may increase the immune system? Mushrooms are immunomodulators. I don't think you're going to see a problem with that. What do you recommend? TA65. Well, TA65, that is the company, and just follow the recommendations that they give. Do they sell the data? I have no idea. You would have to ask TruAge. Does correcting methylation status in someone who has tested severely under methylating help, i.e. giving SAMe? I think SAMe is underutilized. This is a great question. I think SAMe is underutilized. The only thing you have to watch about with SAMe, of course, is the fact that people get agitated, that they go to making, an epinephrine or epinephrine, and they, get in an agitated state. So in most cases, I think SAMe, now, I think the difference is if you're dealing with depression, I would say you need to use a reverse titration dose of 1,600 milligrams downward. Whereas if you're replacing SAMe, like for arthritis or just kind of, generalized support, it's more like 200 to 400 milligrams a day. And I think I'm running out of time, guys. I think I answered about 16 questions, and it is 9 o'clock on the button, and I want to respect the next speaker. Thank you so much for having me. Please look at the TruAge website. I think this is a cutting edge in research that is going to be I think it's going to shape your practice and help you to really get just the outcomes that you're looking for with your patients.